Hi, I'm Dr. Dilip Raja, consulting urologist and enterologist, practicing in city of Mumbai for last about 35 years. I'm affiliated with Leelavati Hospital, Breach Candy Hospital, Saifi Hospital, and Hindu Jakhar hospitals. Uro-oncology is one of my specialities. I also have my private clinic at Bandra on Waterfield Road. Today we are going to discuss few things about kidney cancer. This hopefully will help you understand this problem and probably help you seek an early diagnosis and subsequent treatment. Kidney cancer, as such, is the third most commonest cancer in the genitourinary system. It is more common in men than in women, and it generally comes around the age of 40 to 50 in men. The kidney cancer generally comes up spontaneously, and there is no obvious cause has been found. However, obesity, cigarette smoking, hypertension could be the potential risk factors. Kidney cancer generally appears when the patient complains of one of the three most important symptoms. These symptoms could be pain in the flank region, blood in the urine, and a palpable flank mass on the waist. Now, once one of the three symptoms are present, one tends to look for further investigations. However, this may be associated with some fever, weakness, weight loss. Once it is diagnosed, generally it is done by ultrasonography, which is the most common investigation to diagnose any of the pathology in the abdomen. Ultrasonography will detect a mass in the kidney and will give us a further clue as to this patient needs further investigations. The more investigations which are required, besides the routine blood investigations like CBC, urine examination, creatinine, blood sugar, etc., it requires either an intravenous urography or a CT urography. Intravenous urography not only defines the extent of the tumor, but also can give rise to the presence of a vascularity of the tumor, presence of the parenchyma which is left besides the tumor, and its location, and most importantly, it also tells us the status and function about the other kidney. In kidney, these kidney tumors are, unless proved otherwise, they are known as cancers. Only 15 to 20% of the kidney tumors could be just simply benign, and they could be like a condition called either an oncocytoma or an angiomyolipoma. Once the IVU or intravenous urography and CT urography has been done, another important investigation which is required to be done is a renal angiography. Renal angiography is like a roadmap to the kidney cancer, and which tells us about the vascularity of the kidney and the other part of both the kidney functions and its status. To detect the metastasis of this kidney cancer, we need to do something called a PET-CT scan or sometimes even a bone scan. Once this kind of investigations are completed, the patient obviously is seeking for treatment and its prognosis. The treatment of the kidney cancer is nothing but primarily a surgery which is called a radical nephrectomy. This radical nephrectomy can be done either by open surgery or by laparoscopic or by robotic surgeries. When the tumor is localized in one of the ends, either at the upper pole or the lower pole, or sometimes in the mid pole also, this partial nephrectomy, whereby saving the rest of the kidney, can also be performed. Once we have either decided whether we do the partial nephrectomy or the radical nephrectomy, and if the tumor remains localized, and then probably the cure of this kidney cancer is almost 90 to 95%. To know what is further the prognosis, and after we have finished the investigations and subject the patient to the treatment, it is important to know the staging of the kidney cancer. To describe the staging of the kidney cancer, they are divided into 4 stages. When the kidney cancer is localized within the substance of the kidney, it is called a stage 1 kidney cancer. Stage 2 kidney cancer, when the kidney cancer has just gone outside the capsule but still remains within the Gervais fascia, which is the protective layer covering the kidney. In stage 3, the kidney cancer extends outside of the gyratosis fascia and goes either into the metastatic, into the lymph nodes or into the inferior vena cava. And stage 4 is when the kidney cancer has spread to different organs, whether it's bones, lungs, liver, or lymph nodes. Once these stages are decided, and the prognosis will depend on the stages of this kidney cancer. Once the surgery is performed, the entire tumor mass or the kidney, if it is removed completely, it is subjected to the histopathology examination. Once the histopathology report comes and it tells us about the margins of the tumor, and if we know that that tumor has remained localized within the kidney and has not spread outside of the operated margins, then the prognosis is almost about 90 to 95% 5-year survival rate is known. But when the tumor is metastasized, surgery is also plays a very important role. But the prognosis drops down from 90 to almost about 60 to 65%. In very advanced cases or in a recurrence of this such kidney tumor cancer, sometimes a chemotherapy or immunotherapy may play a significant role in further treatment of this kidney cancer. Thank you very much.